Okay, we're going to finish up with endocrine disorders. Let's take a look at some of these abnormalities that perhaps maybe you've seen and just we're not too sure what's causing them or what they mean. So here, what we're looking at is just nice natural height in this individual. It's called giantism. It's when there's an increase in growth hormone in adolescence and there's an intense growth spurt. That's from increased amount of growth hormone. When the growth hormone happens in an adult and there's an increase of excessive growth hormone in adulthood, you get this condition of acromegaly, where you get this widening of the jaw, you get this thick eyebrow, almost look like a caveman type of appearance. Okay. A goiter is an enlargement of the thyroid gland. When you have hyperthyroidism, you get a condition called exophthalmos. Okay. Exophthalmos is seen with Graves' disease. It's a very hyperactive thyroid. You can see the white of the eyes all around. In average people, when you look at the eye, you can't really see the white of the eye above it. But here, it looks like the eyes are bulging, it's pushing out. That's called exophthalmos. Here in Cushing syndrome, when there's too much or an increase in cortisol, you get that round face, you get the reddening of the cheeks, you get this moon-shaped type of face. You get some other conditions as well that I'll show you. So here's the exophthalmos. You could see the bulging, hyper protruded eyeballs seen with Graves' disease. Okay. You'll also get very sporadic behavior, temperamental people, just snapping. They're just hyper responsive, mentally unstable if it's not controlled. Cushing syndrome, this is when there's prolonged exposure to either endogenous or exogenous glucocorticoids. So, meaning that there's too much cortisol being pushed out in the person. So, you get the reddening of the cheeks, you get the round moon face, you get the thin skin, you get this hump over here called the buffalo hump, right around T1, T2. You get these purple striae or these red striations that look like stretch marks around the chest, around the abdomen. You get this large pendulous belly, but you get much thinner legs in relationship to the rest of the body. So you get thin arms, thin legs, like the chicken legs compared to the rest of the body. You get high blood pressure, thin skin, and very poor wound healing. That's Cushing's syndrome. You'll see these purple striae here, right? You start to see these stretch marks here. You see the roundness to the face. A lot of people get the red cheeks as well. You get that buffalo hump here. And again, you get the purple striae, the stretch marks. All of these as a result of increased cortisol.